Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Now regarding infections caused by the spirochetes and spirochete organisms, gram-negative organisms. We are on the path of the infectiology, that is infection and the disease. And now we are leading to some unusual form of the infection, which are not commonly seen, although it's an important one. I am Professor Sayyid Ali Haidar. I am Honorary Global Professor of Medicine without any name or fame or economics. Not actually, about 30 years before, my uncle said to my cousin, that is his son, that if you bite somebody, you are more poisonous than a king cobra. What? That you are more poisonous than king cobra. He said, what are you talking about? He said that since how many days you have not cleaned your teeth? So he said, I don't know. Then my uncle said that probably, I think it is one year back, at the time of the Eid Fitr, probably you cleaned your teeth. Now, during the last 360 days, you have not cleaned your teeth, just cleaning orally, rinsing your mouth. So your now teeth are so much infected, he said, my uncle said, that you are more dangerous than any venomous type of a object or subject. You are more dangerous. Please, he said, do not bite anybody, otherwise the person will die. Regarding his statement, he said, and he was true, but at that time I was in medical college in first year MBBS, and he said these sentences. Human bite is the international issue, and this is type of the bite has a very, very prolonged history. Ancient times, I think it is after the two sons of the Hazrat Adam alayhi salam, one killed another one, and then you think that there is instinct of the what you call the intrinsic capacity of the human to fight, and then one will win and one will lose. Now, human bites occur in your geographical areas because we are the most illiterate people of the world, one of the. In spite of owning the Islam, do not follow the principles of Islam, and then one is very important, is the hygiene. Number two, to give mercy to the enemy. These properties are usually not present in your geographical areas. So human bite are there, although they come to the level of the primary or the secondary or the tertiary type of the medical care, and it is regarded as the judicial offence, and therefore it will be definitely registered cases are there in Karachi. In Civil Hospital Karachi, if you collect the data, you can from the legal department of the Civil Hospital Karachi, medical legal department, then they will say that about 7, 10, 8 bites 72, 70, 75 bites per year. They come to the civil hospital. APMC also like the same rate, 80 to 100 bites per year, human bite. So human bite is the problem. Is it a safe bite or it is the loving bite? There are many types of bites, and one bite is definitely in what is called as a sexual type of bites. During sexual activity, the bite takes place. It is also recorded, and the different part of the body. Because of the excitation, it is possible. And the other bites are definitely offensive type of problems, and then when the one who is a loser is probably end the fight by biting the other who was actually on the dominant on those person, the winner. The winner do not bite. The loser always bite in the end. Or something else. For example, he picked the it is a brick, and then he will crush the skull to the other. Now there are many stories behind it in Pakistan. Some are hidden, some are opened. Now the media, they showed these cases. There was at one time when we are in medical colleges, we don't know that the human bite is, it is not written even in the Davidson at that time. No name like this. As the men become most prosperous, they are become the more, what is called as the technological superiorities are there. These bites occur in those areas which are actually illiterate zones, basically. Try to understand what I am saying. So I have told you a story. There are many stories, like this is the person, very famous Dracula, bites and sucks the blood. This is definitely a story, vampires and so on. This is actually what happened during the event when the fighting occurs. This person on the right side, he was a winner, but that person was a loser, and he ended up the bite with this, just crushing the external ears. Bite, is very hardly on this. So much so that this person who was taking lead now, he will end up because it's very painful. International incidents that are 4 years retrospective review in the United Kingdom. There are about 13% human bites identified out of 3136 case notes. The majority of those bitten were young males, with 44% of the females aged between 16 to 25 years, and the male to female ratio was 3:1. Of course, it should be like this. In our country, it's probably more. Women do not bite actually during fight. They want to end up the fight with some stick or some other things, like revolver or other objects. Introduction is that approximately 10 to 15 human bites won't become infected. This is the problem, owing to the multiple factors. The bacterial inoculum of the human bite wounds contains as many as 100 million organisms per milliliter and is made up of as many as 190 different species. So the commensals of yours will not become the commensal of the others. It means possibly they are invasive organisms to the person in the whom was bitten. Now it is about, you say that there are about 15% of the human wounds afterwards become complicated. Etiology, that is the cause of the human bite wounds, include the following: aggressive behavior, often in combination with alcohol, the cause of most clenched fist injuries. Clenched fist injuries. The rough sexual play of sexual assault, domestic violence, yes. And in those cases, the female can bite to the husband. It's possible. Child abuse, yes, another problem is a growing problem. Occupational injury to dental personnel. Indeed, it is the, during the procedure. Occupational. Seizure-related tongue lacerations. Seizure in which there is a bite, the tongue bite. Nose biting punishment for adultery in the several cultures. Nose is the honor. If he will crush your nose, he will chew the nose, then probably the end up that his punishment has been done. And one of the, what is a very famous, revenge taken by the wife of the Hazrat Abu Sufyan. She took revenge by the crushing or chewing the liver of the most important personality of that time. And he was the leader at that time, army leader of Hazrat Muhammad, may peace be upon him, and at the Uhud, near the Uhud the fight was done, that is Jang Uhud. And he was Amir Hamza, Raziyallahu Ta'ala Anhu, Sayyidina Rahmatullah alayhi, Raziyallahu Ta'ala Anhu. Now he was definitely, she took revenge like this. So nose biting is the honor. This is the honor. The honor, the most higher punishment of anything is that to cut the liver out and just chew it. And that will probably satisfying the revenging, wish of the person, probably. Accidents during the sporting events. In sports, the last time, Mike Tyson, and now he converted to Islam and he has called himself as Abdullah. MashaAllah, he has accepted Islam. And during one fight, because the fight is very, very aggressive, now he chewed the nose of the opponent. And that was the penalty has been given, and punishment has given a 3 years ban on him. That he is, crazy fighter of all time. Aggressive play of the children in the daycare centers. Actually, because of the supervision is poor, they bite each other. Self-inflicted wounds in person who are emotionally disturbed or mentally handicapped. Like Lashnan syndrome is an uncommon disorder that includes self-mutilation through biting. Self-mutilation through biting. One is, what is called as the masochism, that is. Sadism, masochism, these are type of the things. Self-mutilation through biting. Now, institutionalized persons with a poor impulse control create a high-risk environment for human bite wounds. Institutional person, that they often homes and other homes because they are mentally disturbed and for very, very small, just like a very small argument turned out to be a big argument between the people and they bite each other. It is possible like this. So all are psychological problems basically, most of them. Otherwise nobody can bite to each other. It is not possible because the person, it is a very unhygienic way of taking anything, revenge or something. Very unhygienic way. The table is there with the etiology, the bacteria which are important during the bite are a long list, although what's important is the Campylobacter species, Corynebacterium species, Acnella coryrons, Fusobacterium species, gram, negative basilite, anaerobic, Haemophilus species, Streptococcus species, this is important, the Prevotala species, Staphylococcus aureus species, or whole of the species, Streptococci, and another group of species which is not known to me previously is Venonella species. Acanella, Venonella, and Prevotala. These three organisms are important and they cause definitely different type of a behavior if they enter as bacteremia. And they end up with the endocarditis. There is no doubt about it. Local wound is there is cellulitis, other things are possible. So what is important is the remote type of the problem which is. And that is the vegetative endocarditis. That is the end up of all things. That is why the human bite will be registered as a legal offensive offense. It is offense. Depending upon the type of the injury, the mild or the moderate or severe, this is another judicial type of the problem. But actually, for us, is important is this. Most of them are the gram-negative or anaerobic bacteria, uncommon bacteria, now become important. Pathophysiology, there are two types of injuries. Actually, one is clenched fist injury. Clenched fist injuries are the most common and have the greater clinical significance. They occur as the closed fist strikes the teeth of another individual with sufficient force to create a small wound. It is not actually a bite, but during the boxer, he boxed to the mouth and then the injury took place. And it is the most important part of the hand, the dorsal surface of the third and the fourth metacarpophalangeal or proximal interphalangeal joints of the dominant hand. Because of the thinness of the skin in these areas, potential injuries include joint penetration, metacarpal fracture, extensive tender laceration, injury to the digital nerve or entry, although it is rare. As the fingers extend following injury, the bacterial inoculum may be carried proximally with the extensor tendons, and this makes the adequate irrigation of the wound more difficult because the inoculum actually goes inside. If you just wash it out, it is difficult because it is now penetrated. These are the most serious human bites wounds and they require the most aggressive treatment. Actually, they are clenched fist injury. It is the opponent injury. One who is dominant to the other in the field of sports, clenched fist injuries are usually occur. Or during the fight of man to man usually. Very high, powerful clenched fist will cause these type of problems. Second are occlusive bites. In this occlusive bite occur when there is a sufficient force to break the skin. Such injuries to the hand have a higher infection rate than similar bite to another person of the body because of the thinness of the skin in the area. Occlusive bites. When a finger is bitten, for example, because this is the problem, it is direct injury. It is indirect injury, it is a direct injury. Now, it occurs when there is sufficient force to break the skin. Such injuries to the hand have a higher infection. Hand chewing during fight, lip chewing, nose chewing, ear chewing. The humans are the most higher level of the livings. Of the livings now become wild. Remember, these are the type of the problems that are going on in your society. When a finger is bitten, such as a jumping type injury, tendons and the overlying sheaths are in close proximity to the skin, the wound may appear to be a minor abrasion type injury, but careful inspection is required to rule out deep injury. Finger is, usually the one part which can be chewed. Occlusive human bite wounds of the head and the neck result in the evulsion, laceration, crushing of the tissues. Even so, when the tooth strikes the head, even a deep puncture wound may appear innocuous. However, the deep subgaleal or a bacterial contamination is possible under it. Deep wound infection, deep tissue infection. This is especially true in the young children who have relatively thin, soft scalp and forehead tissues. So these are occlusive bites. The clenched fist injuries are one is active, one is passive. And this type of the injuries. You chewed your opponent, you got your injury to yourself actually, not to him. He has a broken teeth, that's all. The clenched fist injury. Occlusive bites. So it is direct one. It is indirect, it is direct. What is called makafat amal in this case. have broken his teeth, and the Almighty Allah gives you punishment in this world, and by causing wound infection and bacteremia, septicemia, and even a path of infection is going on, and the patient will end up with what is known as the septic shock. Clenched fist injury is like this, which is here is a clenched fist, and here are these are the injuries. Now this one, look, it is the first, the proximal one, this is the middle one, and the lower one, interphalangeal joint or metacarpophalangeal joints. These are affected. There are wounds all over because of the clenched fist. It is they are striking on the teeth. Occlusive injury like this, they chewed up, these areas. Afterward, before injury, after injury, they have, the dressings after washing or purging has been done to this patient. The clinical evaluation history is important. A thorough detailed history is necessary to facilitate communication between various healthcare professionals involved in the treatment of the patient and to document why the plan of the care was appropriate. The photographic documentation should be considered. It is extremely important that the chart reflect the following: that an adequate initial evaluation, an appropriate care plan, and that the patient was counseled regarding the potential complication and importance of early and regular follow-up care. When questioned as to the nature of the injury, the patient often mislead the examiner out of the embarrassment, the fear of the legal repercussion. This is particularly common in bites that occur during sexual activity, love bites to a breast. It's common. Consider all injuries dorsal to the metacarpal joint to be the wound, bite wounds until proven otherwise. This is the international law in this case. Metacarpal joint, if they are injured, ask the person what will happen actually, how it occurs. Because explanations offered of such wounds are often misleading. Extreme caution is necessary while careful explanation of the need of the accurate history may elicit the truth. The patient experienced emergency physician often treats such injuries as the bites regardless of the history. Wound is a wound, whether caused by a bite or something else. But the legal perspective is important. Most bite wounds infections are not present at the initial emergency department. The closed fist injury, the initial injury, often appears minor to the patient. Thus, no care is sought until the infection develops. If a child receives a small laceration to the scalp or the forehead during the unwitnessed horseplay, careful ascertain whether the tooth caused the wound to minimize complications. The other aspect of the patient history may influence care include the following: the tetanus immunization status, previous, and time delay for the injury to the presentation. They will decide the incubation period of the respective type of organisms. Disability encountered, presence of underlying immunosuppressive disease, natural history of the wound. Obtain the following information about the natural history of the wound, circumstances surrounding the injury, precipitating event or activity, exact mechanism of injury, time of occurrence, location of occurrence, whether the other party involved is known to the patient, available should testing be indicated, now treatment initiated prior to the presentation. There may be a dig history behind because it is depending upon the immunosuppressive like steroids. He was on steroids. Then the chances of the spread of the wound is more. Sign and symptoms related to the wound are concerned, inflammation, pain, fever, swelling, discharge of the odor, and tobacco, alcohol, or recreational drug use, medications or allergies to the medications, tetanus immune status, ability to comprehend the magnitude of the injury and to cooperate with the treatment plan. So comorbidities. Comorbid condition that may play the high risk of the infection: diabetes, chronic kidney edema of the region, that is prior ipsilateral axillary node dissection for upper extremity wound, prior splenectomy. That is important for 3 organisms which may be present in the inoculum. And you know that they are all gram-negative organisms basically. Liver disease, immunosuppression, presence of prosthetic valve or joint, that is important. Renal, arterial or the venous disease, and legal considerations. Human bite injury causes are often assault cases and more likely to involve the judicial system. With that in mind, documentation should be clear, concise and complete. It should be notified to the judicial department. Moreover, most jurisdictions require the medical professional to report suspected child abuse. That is important also nowadays, as the media exposed the many people. Differential diagnosis: the animal bite to the head and neck. Any other animal can bite. Cellulitis, hand infections, and insect bites, and tetanus. This will include the differential diagnosis. After 10 days he arrived with a localized type of a spasm. Possibly your tetanus will be there, not the full flesh, because the immune status was not bad in this patient. So these are the differential diagnosis depending upon the arrival time of the patient. Work of the lab studies. No lab studies are required unless you can go to CBC, you can go for the CRP, you can go for the ESR, it depends. Otherwise the local examination is enough. However, radiography is important when there is a close injuries, and that is important. An indicator, that is the periostatis or osteomyelitis, have occurred in this condition after the bite. Now this is how it is. After bite, what is this? And after the bite, this is actually a denture, which was actually penetration by biting this person. He loosed that denture into the hand. The surrounding areas, they are all swollen up. Unusual X-ray. This is not artifact. This is the denture. Look, the things which are there in the dentures. This is a part of the denture which actually a dental surgeon placed to hold that denture. A ring, around it tightly. That is now detached, and it is now in the part of the tissues of this hand. It is very important now that it is a foreign body reaction will occur. Management, wound cleaning will be done of the pyodine, and what is available should be done thoroughly. And the cleansing of the wound should be done properly. Wound closure is a source of controversy in the management of the patient with the human bite wounds. If it needed, then stitching should be done to stop bleeding. And they said they allow such wounds in which are the puncture wounds and infected wounds or wounds more than 12 hours old to heal by secondary intention. They may be closed secondarily or revised at a later date, but at this time it should be opened and you give the prophylactic antibiotics after the wound cleaning. After giving the tetanus vaccination, tetanus prevention, the active and the passive vaccination should be done accordingly. If it is active, you are doing, then no problem. The tetanus toxoid should be given at 0 days, and then after 1 month, and after 3 months, the 3 doses. But the anti-tetanus serum should be given because the person doesn't know about the status of his tetanus. He can't remember. So give the ATS. In our society, we have to give the ATS. The human tetanus serum is our anti-tetanus serum are important one, and they do not need to be causing the allergic reactions. Antibiotic use, this is the chemoprophylaxis, should be given for all bacteria, like quinolones should be used in these cases. And the second or third generation macrolides and the beta-lactam antibiotics, they all should be used in a full dosages. I will say the full dosages. Because if it occurs at the bacteremia, septicemia, and then the path of to the septic shock, you will definitely, the patient will, high mortality rate. Surgical measures are needed accordingly. If it is the wound is definitely is very, very penetrated, accordingly the surgery is planned. Only stitching is there, and the orthopedic, if it is a broken bone, etc., etc. These are the surgical measures can be planned accordingly. Now these are the circumstances of the human bite. At the end I say that in Allah ma sabirin, if there is a fight between one person to another, go for the la hawla wa la quwwata illa billahi al-aliyyil azim, and then after that you accept that I am the fault, you are right, I am wrong, and that will ended up this fight. And again give the salam to that is Durood Sharif should be Durood Ibrahimi should be for both of them are a good bond between one Muslim to the other Muslim. وما علينا إلا البلاغ. السلام عليكم ورحمة الله وبركاته.